Live. All right, we are live. Oh, there's a little bit of echo. Hi, everybody. Let me see. I wonder why it's echoing so much. Can you hear the echo, Jarrad, on your side?
No, not too bad. Sounds fine.
Okay, great. Okay, cool. Hi, guys. If you're joining us, like and say hi. We're excited that you're here with us today. We are keen to start this conversation. It's a conversation that's been highly requested for this community, and so we're excited that we get to share this with you. So if you're here, say hi. Just swipe in and let us know that you're here. Hi, Tanya. Hi, Pat. Nice to see you guys. We'll give a few more minutes just to get everybody with us joining us. All right. Hi, Michelle. Hi, Michelle Rogers. Nice to see you. All right. Everybody there, Michelle, how's the audio on your side? Is it doing okay? Can you let me know? Just want to make sure you guys can hear us okay. Hi, Leslie. Cool. This is great. Yes, we are looking forward to this session. Michelle, yeah, for a lot of people that are recovering from COVID, this is a very topical conversation. Hi, Cheryl. Just a few more seconds. So, Jarrad, how are you doing today? We can actually just make sure that people get to see you as well.
I'm good, thanks, Tash. As it happens, someone with a leaf blower has just started doing their thing next to me. That doesn't include too much.
That is always the case. Hey, if it's not dogs barking and motorbikes, it's something else. Okay, awesome. Guys, keep saying hi as you're coming in. Hi, Karen. Hi, Tiff. Okay, great. Thanks, Michelle. Hi, Megan. Awesome, guys. All right, so if you're just dialing in and joining us, you don't know what's going on, we are actually doing a Jeff Ed talk today on the returning to exercise after COVID. And so I've got Dr. Jarrad Van Zuydam joining me today. And Jarrad's going to be doing a presentation for us and sharing some insights and just what he's seen in his industry. So just give us a few more seconds as we let people come on, and then we're going to go and get started. Awesome. Hi. Say hi as you're joining. Hi, Kelly. Coach Kelly is joining us. Hi, Sharon. Hi, Carol. Hi, Deline. And Lydia. Awesome. Guys, we actually are going to have a little bit of a question and answer at the end too. So please make sure to have those questions ready at the end so we can have them, check them, and maybe respond. I think a lot of your questions may be answered already in Jarrad's conversation with us today. So keep those questions and let's get them going. All right. Hi, Allison. Hi, Joy. Hi, Samantha. Taryn, Tracy. All right, I think we are going to get going. All right, so if you're joining us, the conversation today is returning to exercise post-COVID. Such a topical conversation. And so why did we bring Jarrad here today? So Jarrad is a sports physician in private practice at the Waterfall SOS Sports Medicine Center and an honorary lecturer at the Wits Institute for Sport and Health. He spent 7 years as a team doctor on the Professional Cycling World Tour and has helped athletes at the world's biggest races, including, you have to tell me how to pronounce the Giro. I can't always pronounce that correctly. How do you pronounce that?
The Giro d'Italia.
Italia. I want to add an Italian flair in there, and I shouldn't do that. And then same with the Tour de France, and then the Paris-Roubaix. I don't know how to say that.
Paris-Roubaix.
Paris-Roubaix. Thank you, Jarrad. And then Jarrad's as the co-founder and the chief medical officer at CoronaFighter. It's a rapidly growing startup helping organizations get their employees and contractors back to work safely. And so that is why we've asked Jarrad to join us today, because he has an understanding of exercise and working in this space with Corona and fighting Corona at the moment as well. So Jarrad, over to you. Are you there? Oh no, I think we've lost your sound. Oh boy.
There we go. Is that better?
There you are. We're keeping people on the edge of their seat today.
I think I was trying to unmute myself and someone else tried to do the same, so it just ended up muting me.
Go for it.
Firstly, thanks very much to Jeff, Ed, for the opportunity to speak to you guys. I think it's a really important topic at the moment, and it's something that I'm answering phone calls and messages and emails all the time about. So it's good to try and get this knowledge and information out to everyone, so that people can have a bit of guidance in terms of what they should be doing and what they shouldn't be doing. So as a disclaimer, I'm not a virologist or an infectious diseases specialist. I'm not a cardiologist either. So we won't be getting too deep into the weeds in terms of the virology or cardiology. But what I'd like to get from this, or what I'd like everyone listening to this talk to get from this, is to learn sort of after recovering from COVID, when is it safe to start exercising again, and how should one go about restarting exercise. And even more importantly, when should someone definitely not be exercising? So if we can answer those two questions, then I think we've done a decent job. So I'm just showing you this slide to try and show you that we are on the same team. So sports physicians desperately want to keep you exercising, because we know the huge benefits of being fit. And we only ask you to stop when it's in the best interest of your good health. So toward the start of the pandemic, I contributed to this publication in the South African Journal of Sports Medicine, imploring COVID decision makers in government to allow people to exercise even during a stage 5 lockdown, because of the benefits to health, to mental health, and especially to immunity, and helping you to fight off the virus should you get it. Okay, so let's get into it. Firstly, I'd like to define the problem and explain why everyone is so worked up and panics about the situation. So during and just after the first wave of the pandemic last year, it became pretty clear that the SARS-CoV-2 virus was not just a cold virus on steroids, but that it had significant adverse effects on multiple organ systems, and mostly due to its entry point into our tissues, which is the ACE2 surface protein on our cells. What was noticed early on is that many sufferers had some degree of heart inflammation, which we call myocarditis, or some of them pericarditis. And some who recovered after COVID had evidence of permanent heart damage. Two studies in particular caused a fair amount of panic in the world of sports medicine and cardiology. The first was a study of 26 competitive college athletes in the US, and it was found that 15% of them, after having suffered from COVID, had evidence of myocarditis, and 31% of them had evidence of cardiac injury of some sort. And the scary part of this was that some of these patients had not been symptomatic at all. So in other words, they had very mild disease, and they still had evidence of cardiac damage after they'd recovered. The other study was done in Germany. It was on a bigger group, 100 patients. And in that study, they found cardiac involvement in 78% of the patients and ongoing myocarditis in 60%. And these were also independent of pre-existing conditions, the severity and the overall sort of course of the illness. So there wasn't a good correlation between how bad your COVID was and your risk of getting heart complications. So this was really pretty scary, and people were pretty worried about this, and there was a bit of panic. To be fair, a lot of these patients in these studies were older and had other diseases, comorbidities, and there have been some more recent studies that haven't been able to replicate these very high numbers in terms of the cardiac damage. But it was certainly these two studies which sort of lit the fire and got people talking, and made us start reconsidering whether we should allow athletes to get back to competitive sport, and what sort of investigations would be necessary to allow them to do that. So what is myocarditis? We've obviously mentioned that there, and that's one of the concerns during COVID. It's essentially inflammation of the muscle tissue of the heart. And the problem with that is that it can lead to ongoing malaise and fatigue, and can also be the start of dangerous arrhythmias, so irregular heartbeats. And these arrhythmias can lead to an athlete suddenly dropping dead on the sports field. And I mean, obviously that's every sports physician's worst nightmare. So until we had, we were able to sort of quantify, how real this risk was and how big this risk was, the advice was really, don't exercise during COVID, wait, a month after COVID, and there were various sort of opinions out there. And then also, if that weren't enough, it's not just the heart which we need to worry about. So athletes after COVID can also suffer from permanent lung damage, thromboembolic disease, which is, disorders of clotting, either in the legs or being affecting the lungs as well. And then also the so-called long COVID syndrome, which we will sort of try and touch on later. So after all of that, there was a fair amount of panic, and there was misinformation being distributed. There was disagreements among academics. There was ignorance in terms of sporting regulatory bodies, and generally a bit of chaos, which I suppose is to be expected after learning something like this, and having this big concern that our athletes going to be heading back to sports and dropping dead. So most of my talk will focus on the cardiological implications and complications of COVID-19 in athletes. Obviously, athletes tend to rely on their hearts pretty heavily, and so for this reason, athletes may notice cardiological symptoms in their workouts when couch dwellers actually don't even know that there's anything wrong. So also there's concern that athletes who ignore these symptoms may worsen their pathology and then risk career-ending cardiac injury or worse. Various academic groups have published opinion pieces and guidelines over the last year on how to approach a return to sports after COVID, but there's still no worldwide unifying consensus statement that's considered the gold standard. So I've chosen to take you through the recommendations recently put forward by a team led by Jonathan Kim from Atlanta in the US, because I believe that their approach is well-reasoned and more cost-effective and appropriate for a relatively resource-poor country such as ours. Just be aware, though, that there are other guidelines out there, and some of them are being employed in Britain, and they over there take a slightly more aggressive approach in terms of the investigations that they would go through for an athlete. So unfortunately, at this stage, nobody knows which approach is best. So time will tell, as more data becomes available. So the full article, as well as an accompanying podcast episode, is available for free online. So for anyone who's interested in seeing, the actual nuts and bolts of the paper and reading it for themselves.
So just sorry, I didn't want to interject there, but I think what we could do is we could share that in the description here for people afterwards if they want to see that.
Absolutely, yeah, I think that's a great idea. This flowchart over here really is the meat of the document, and it summarizes the suggested process for competitive athletes once they've had a positive COVID test. There are two other very similar charts in the same paper, one for high school athletes and the other for recreational masters athletes, with slight differences, but I've chosen to highlight this one, and we'll talk about some of the differences later. So before we begin to try and decipher the pathways, we need to be able to classify the severity of the disease. So that's key to anything here. So you'll see at the top, once you've had a positive COVID test, the next step is to try and define how severe your disease was, and that's going to then guide you in terms of your next course of action. So I've made an easy sort of COVID comparison table for us there, and we can sort of divide them into four separate groups. So asymptomatic, mild disease, moderate disease, and severe disease. So asymptomatic cases are those without any symptoms at all. So they're the people that are walking around that don't know they even have COVID. So the diagnosis is often made incidentally. So when they're forced to swab for having had a contact or travel purposes or whatever it might be. So these are really the asymptomatic patients. Mild cases are those with symptoms, but for whom the illness feels no worse than a bad cold. So the symptoms are mostly upper respiratory and gastrointestinal, you know, so they've got a headache, they've got a bit of a sore throat and congestion. They may have some mild vomiting and diarrhea, and they often have the typical anosmia or ageusia, which is, you know, the loss of taste and smell. Once you get to the moderate cases, these guys and girls are pretty ill, actually. So they're likely bedbound for a few days just because they really don't feel like getting up at all. And they've got more serious symptoms like persistent fever or chills, COVID pneumonia, or a drop in their oxygen saturation. Heart symptoms are included here, and so these are shortness of breath, chest pain or tightness or feeling of pressure on the chest, and palpitations. So if anyone suffers from any of those cardiac type symptoms, they straight away considered a moderate case at least. And then the severe cases are very easy to identify. Those are the ones that are so sick that they need hospital care. So that's the first way of thinking about classifying, you know, the severity of your disease. And then, you know, the next step would really depend on which of those categories you or your patient fits in. So unfortunately, the asymptomatic cases, you know, no symptoms does not equal no problem. Because from some of those studies, what we've seen is that even those who are asymptomatic can go on to get significant cardiology. So we don't ignore them, and we do still proceed carefully in terms of their return to play. So asymptomatic individuals need to self-isolate and rest completely. So yes, shock and horror, no exercise at all for a period of 10 days from their positive test date. So I'm going to just divert quickly to address a serious condition which tends to occur at this point called Canagis syndrome. So Canagis syndrome is a well-known phenomenon, but I've found it to be especially strongly associated with COVID. Milder forms are usually not harmful, but in the more severe form, it can obviously lead to complications. It's definitely very common and severe in runners. The diagnosis is easy to make. After I advise a patient on a period of rest, the patient will immediately respond with, "Doc, can I just do a 5K, nice and slow?" And that's Canagis syndrome, where the patients try and bargain with you. And unfortunately, the answer for COVID is absolutely not. So the cure there is a clear and resounding no. But you know, they'll often beg and plead a little while longer as well. So back to the topic at hand. Aside from the prescription of rest, no blood or cardiac investigations are necessary at this point. So after the 10-day period, if the athlete is now they've always been asymptomatic, so they're still asymptomatic, they can start on a slow and graded escalation of their activity over several weeks, guided by someone in the know. So that's generally going to be a sports physician, it's going to be a physio, it's going to be an athletic trainer, you know, someone like that, a biokineticist. So there's various professionals who would be able to advise in terms of how you would escalate that training. But I'm going to show you a little trick later that might help you as well. If at any point during this process, so during the time that they're trying to escalate their training, they go on to develop symptoms, you know, so they were asymptomatic and then all of a sudden they started to try and some training and they develop significant symptoms, then at that point they should immediately be referred to a sports doc or a sports cardiologist for investigation. So if not, they can return to competition once their fitness is sufficient. It's still likely going to be, you know, over a period of a month or so, because they will have lost some fitness during that 10-day period, and the virus itself will have stolen some of their fitness. So a note here is that these athletes are often shocked at their fitness losses when they go back. They generally feel pretty useless for the first week or two, and they may even notice elevations in their resting and effort heart rates. And if they don't experience any other more specific symptoms, they can be sort of reassured at this point that this is pretty common and advised to just sort of keep going, listen to your body and increase the load nice and slowly, you know. But, you know, I've had quite a few patients who say, you know, that they've gone from being really as fit as they've been in their lives and going really back to square one. And that seems to be quite a common situation. So mild symptoms, and this is the category which I think most of our patients will fit under. And the process here is very similar to the asymptomatic cases, except that the 10-day period starts on the day that the first symptoms presented, and continues until such a time as all symptoms have resolved. So usually that would be a 10-day period of absolutely no exercise, but if on the 10th or 11th day there's still some symptoms, then that period should be extended, and you shouldn't be exercising at all if you still have symptoms. So again, Jarrad syndrome is common, so look out for it, and just be firm in terms of your guidance with these athletes. No extra investigations are strictly necessary unless the course of the disease is especially drawn out and the symptoms don't seem to be improving as expected. And if that were the case, you would refer to a sports cardiologist or a sports physician. If they get back into some exercise and their symptoms return, then refer. So very similar to the asymptomatic cases as well. This, we must highlight this, and this is the same for any person going back to training. If the training itself provokes their symptoms and brings on the symptoms, then that's a clue that there may be something else going on there. In the moderate category, so these are patients who've had significant disease, and they're actually at a higher risk for the development of cardiac complications. So they should also isolate for a minimum of 10 days, and they should only isolate once symptoms improve. No exercise should be attempted until at least 10 days after the symptoms resolve. So in other words, they're symptom-free, they should wait an extra 10 days. So we give them a little bonus 10 days on top of the rest that they've had, because they've had more significant disease and they are at a higher risk. So this means that these athletes are often away from sport for longer than a month, so manage expectations as well, and make sure that they understand that it's going to be a bit of a process. Once this period has passed, they need to be assessed by a cardiologist before being allowed to return to play. So this is the first level at which we insist on some form of cardiological investigations before we allow them back, just because the risk is so much higher in patients who've had significant disease. So those investigations at a minimum would be echocardiography, which is an ultrasound scan of the heart, and ECG, which looks at obviously the electrical activity in the heart, having a look for new arrhythmias, and then blood tests, which look for signs of cardiac damage. Only if given the all clear here, then they should be allowed to slowly get going. And again, if any abnormalities are detected during that assessment by the cardiologist, they'll probably be referred for a cardiac MRI scan, which looks to be the gold standard in terms of diagnosing patients with myocarditis. In the last category, hopefully you guys won't be dealing with too many of these, but obviously these cases are very unlikely to present with Jarrad syndrome. They are very ill patients, and some of them will have been on oxygen and ventilated, and so that they're not going to be motivated to get back into exercise in a hurry. So the cardiac testing here would normally take place during their hospital stay. And they'll need to then avoid exercise for a further 2 weeks after the resolution of their symptoms. So, they get, as I said, another bonus period to try and recover. So after they've had that 2-week period, they should then be evaluated again by a medical professional, usually a cardiologist, and the cardiac testing will be done at that point if it hasn't been done in the hospital already. If a significant cardiac injury is diagnosed, then the return to play guidelines will be the same as for someone diagnosed with myocarditis. And the return to play guidelines for someone with myocarditis take longer than 6 months. So it's a really very gradual reintroduction of activity and very gradual loading. So these are the sorts of cases that would really need to be handled with a lot of care and under the supervision of a sports doc and a cardiologist as well. So So that helps just to try and stratify, the different cases. And the vast majority of people are going to be in those first two categories. So they're either going to be asymptomatic or they're going to have some, minor symptoms. But just be aware that the course of action is going to be different based on what's happened. So we've pretty much summarized what goes on here. So, asymptomatic, no compulsory cardiology assessment, and the same with sort of mild symptoms. Once you get to moderate symptoms, then you do need to be assessed by a medical professional, and that's going to be, the echo, the ECG, and the blood test. And with the severe guys, then absolutely, they'll most likely be assessed by a cardiologist in hospital, and if not, they will be assessed. They should be assessed once they're discharged as well. So it's a pretty busy flowchart, but I think that should help you guys to be able to interpret it a little bit better. And as I said, it's all freely available, so you can go and study this pretty carefully, or even print it out and just have it on hand to guide.
It's fantastic. Thank you so much. Yeah, keep going. But I'll just share that we're actually going to make an effort to get that out to. I know the coaches are looking forward to that for the one-on-one clients that they are coaching through COVID. So it's a great resource. So we'll definitely share that. Thank you.
Absolutely. And as I said, there are other guidelines out there, but a lot of them took a far more aggressive approach. And we're not sure that it's appropriate to be referring just about everyone who's had COVID for all these advanced investigations, because we've got to also realize that a lot of them are very expensive. If you're talking about a cardiac MRI, it's going to be a lot of money, and there's not enough cardiologists out in the country to get through everyone in terms of screening. So we need to be able to select which patients we would refer on for further investigation. So that chart's helpful in terms of deciding who gets it. So that's pretty much it for the cardiac side of things, and I'm just going to briefly touch on the respiratory stuff. So I mean, the cardiac complications were enough. The lung consequences of COVID can also make a return to sport pretty difficult. The early evidence shows that most people will recover fully soon after the illness, but there are some that report persistent symptoms that resolve over the following month. So this is your athlete who says, look, I really feel fine, but if I increase my intensity a little bit, I'm a bit out of breath, a little bit breathless, and this is quite a common finding. With someone like that, you should just listen to the athletes and keep the intensity at a point that isn't sort of getting them into a breathless state, and slowly increasing that intensity or the training volume. So most people, a small subset may go on to develop a new asthma-like disease, which may be the result of permanent damage to the airways. And this is generally going to be in those patients who've had COVID pneumonia and have been on oxygen or have been in hospital for their disease. But it does seem to be causing asthma-like illness in some athletes who've recovered from this. So in an athlete who's got persistent or worsening breathlessness, they should definitely be investigated by a pulmonologist. And, they're going to do things like a chest x-ray and a couple of investigations to see what the lung volumes are like and how the lung is functioning. And then they'd be guided, from there. Then just a quick mention of something, the so-called long COVID syndrome. I'm sure some of you have heard of it or been reading of it. So it's emerging that some patients don't seem to recover as quickly as expected, and they go on to experience prolonged multi-organ symptoms and complications. And usually these are symptoms like chronic cough, a bit of shortness of breath, chest tightness, cognitive dysfunction, or the so-called COVID brain. I mean, people have been joking about that, but it's a real thing. People sometimes get a bit foggy in terms of their cognitive function. But fatigue seems to be the most prominent and usual complaint, and this tends to go on a little bit. In one survey in the UK, 1 in 5 people had symptoms that lasted for more than 5 weeks, and 1 in 10 had symptoms that lasted for more than 12 weeks. So it's not all that uncommon, and it can drag on a bit. To be fair, most of these cases were observed in older patients with other diseases, and not necessarily in the athletic population. So there's still a lot more research that needs to go on in this area. But perhaps it has some relation to the post-viral fatigue syndromes that we sometimes see with other virus infections like Epstein-Barr virus and cytomegalovirus and a few others. And even those, we don't fully understand. There's also almost certainly a mental component linked to symptoms of anxiety, depression, or other mental health issues, which can be worsened or even brought on by COVID. Okay, so that's really my presentation, but I wanted to give a chance for some Q&A, I suppose. I've selected a couple of questions that I think are essential to answer, and then I think Tash has a few more lined up. So let's just get through. I've got 3 or 4. So the first one is really easy to answer. So no. So I mean, that's really something that we need to be pretty strict with in terms of our patients, is that if they've got symptoms of COVID, they should not be exercising, and that's the end of it. It's not a cold, it's not the flu. It really can have permanent and lasting effects. So let's all unite in terms of that guideline.
Sorry, not to interrupt you, but just on that, the questions have been coming in. So before we jump away from that, sure. So we offer guided walks. We offer flow classes, which would be like a stretch and yoga. So people are asking, can they do that, or are we talking, when we say exercise, strenuous exercise, or what would we categorize?
Yeah, so I mean, that right there is a form of Cannager syndrome, and
I kind of figured.
Yeah, so that's what I'm saying. This thing is really quite common. So no, you should really be doing the minimum amount. So you should be walking to, the dinner table, and you should be walking back to your bed and walking to the bathroom. But there should be nothing that can be considered like a focused exercise session. And even if that is just a slow walk, I think it's safer just for those 10 days, it's not going to kill you, just to really allow your body time to recover and fight off the virus, So those are the guidelines at the moment. It may change. There might be trials coming up which experiment with allowing people to start exercising during the symptomatic period. And, if that data becomes available, then sure, we'd be able to change our opinion there. But at the moment, the advice is to avoid any structured exercise for that period.
Yeah, listen, I'm smiling because you don't know how diehard these Jeffers are and how they stick to their workout. So thank you, because it helps us as coaches as well to guide them. So, all right, go ahead, continue.
So this question I thought was important because that a lot of patients might head to their GP and get a quick ECG and then say, oh no, I'm fine, and get straight back into their training. So is the ECG sufficient on its own to detect COVID-related heart damage? And the answer there is no, probably not. So, the ECG is a useful and cheap tool, but it isn't sensitive enough to pick up sort of all cases of myocarditis. So it would pick up the more severe cases, but borderline cases it definitely wouldn't pick up. So the gold standard test is a cardiac MRI scan, and that needs to be done in an experienced specialist center by someone who understands the changes to the heart that athletes have just because they're athletes. Obviously, that's massively expensive, so that's why we sort of try and decide who gets it and who doesn't. But if you're having cardiac symptoms and you go for a quick ECG, that doesn't necessarily mean that everything's okay. Are there any special recommendations for masters athletes? And I think this is also an important question, because a lot of our athletes are sort of, and in the masters, I mean, older than 35. So we all probably fit in that category. So it's a pretty important one to answer. So in the same article, it goes into some detail about special treatment of masters athletes, but there's a slightly different flow chart. The main difference being that masters athletes older than 65 years, and particularly those with pre-existing cardiovascular conditions like hypertension, coronary artery disease, atrial fibrillation, diabetes, etc. And those with persistent symptoms, that they should be considered for cardiac testing. So it would be pretty similar to the normal flow chart, but you would just lump people with pre-existing conditions as well as those older than 65 into a more high-risk group and consider them for further testing. This is the little trick I wanted to show you guys. So where can I get guidance on how quickly to ramp up training? So I actually built a tool for this last year already when, after the first wave, when people were asking, how quickly can we get back? So there's no precise answer. I can't tell you exactly how quickly to do this, but this tool can give you a little bit of guidance. And each athlete will be different. You can also get some feedback from an athlete and see how they're doing and decide, okay, well, let's go a little bit faster, or no, let's slow down. They're struggling a little bit. So this tool is available at insightfit.com. So go and have a look. I can take you through it now if you'd like, or would you prefer just to have a look at it in your own time?
Go for it. I think it'd be great if we could see this resource that we can use. So yeah, go for it.
Let me just try and sort that out.
Everybody here with longer for this information because it's very informative.
Okay, so this is what it looks like. It's available, as I said, at insightfit.com, and it's just a tool to try and help you in terms of guidance. So you just click through on the first one. Firstly, it's going to screen you for symptoms. So if you say that you're feeling a little bit symptomatic, it's straight away going to tell you, look, it's probably not best to be exercising at the moment, which fits with what we've just described. So if you say, no, I'm feeling perfectly healthy, then great, you go ahead. So it says, great, you're feeling well, let's get you back to full training. And it asks you a couple of things. So how many weeks at a reduced training level have you had? So how many weeks of rest have you had? So you might take someone who's had, they've taken their 10 days and they've then taken an extra 4 days off, perhaps. So you say, for 2 weeks, I've had a reduced training load. Then it asks you, during those easy weeks, what percentage of your full training load were you at? And if you're following the advice, you should be at 0% for that period. So you can just put a 0. But it would work just as well for someone who has been recovering from another illness and has maybe been at 50% for 3 weeks, for instance. So it uses those two numbers to spit something out. It asks for an email address just because it'll send you a PDF with your information and your guidance. And you click done. So it'll give you a little spiel saying you're free to start ramping up your training. Follow advice to slowly increase your training in the safest manner possible. So you had a period of 2 weeks at 0% of your training load, and you should incrementally build up your training load over a period of around 4.6 weeks. So that translates to around 32 days. So for someone even who's had only 2 weeks off, it's going to take a full month and a couple of days to get them back up to their sort of previous level. This is not precise, but it's based on good science, and it's at least some guidance. So I don't know. I think that's possibly helpful.
That's super helpful. Yeah, that's super helpful. Thank you. I think Coach Adrian already posted the link there in the comments, so thank you. So if anyone wants to see it.
And then I think that's just about it. Oh, the vaccine, should I take it once it's available? Absolutely, yes. So we're a little bit worried about whether when we're going to get it and how soon and whatever, but people have been asking, will you take it? And absolutely, yes. So we need that vaccine as soon as possible, and it's the one thing that might get us out of this nightmare. Yeah, that's about it.
Okay, well, thanks, Jarrad. I have a few questions. I saw Lydia ask this question, and I think it's quite pertinent. Is it true to say that the fitter and healthier you are, the less severe the virus is likely to affect you?
So to some extent, yes. So as we all know, it tends to be older patients and those with comorbidities and overweight and a couple other things that really increase your risk of severe disease. But there are outliers, so sometimes we get athletes who are really in the shape of their lives, and we're really surprised when they have, quite severe disease. So there's probably some sort of genetic component which we haven't fully uncovered just yet that plays a role there as well. So yes, by staying fit and healthy, you absolutely are giving yourself the best chance of not getting severely ill or not even getting it in the first place. but it's no guarantee. So these attitudes of, I'll just get it and then I'm immune, I'll be fine. No, everyone should be scared of this virus.
Yeah, that's great. I mean, I see my husband actually commenting over there in the comments, and I know that he feels that had he not been fit when he got COVID, he probably would not have fought it off as much. But like you said, there are outliers. We hear of very fit people that have had severe cases. So it's not necessarily the truth. It's not a blanket statement, but it does help us with our entire immunity to have a good base of fitness and nutrition. So based on, or leaning into the next question, then should my nutrition change when I'm returning or exercise?
So when you're returning, I mean, your nutrition should be, of course, we're always going to talk about, keeping a good balanced diet in terms of, avoiding processed foods, avoiding, processed sugars and sticking to clean whole foods. And I know that that's something that, you at Jeff already preach. But in the recovery period, you may need to try and eat a little bit more. Your body's really trying to rebuild after that. You've lost a lot of muscle mass, and there's various other processes that are trying to rebuild. So at that point, it would be particularly important to be taking in, enough and trying to eat possibly even more than you normally would, or more than your appetite is dictating. In terms of specific superfoods and all sorts of things, I steer clear of dispensing any of that sort of advice. I think your guiding principles should really be broader than that in terms of eating a good balanced diet with loads of fresh vegetables, some fruit, and good lean protein sources as often as possible. And I think that's probably the best way to look at it. In terms of supplements, I mean, there's a lot of hoo-ha about vitamin D and vitamin C and a couple of other things. There's nothing in the evidence that is shown to be miraculous, unfortunately. So we do know that those who are low in vitamin D do worse when they get COVID, but we can't show that taking vitamin D during COVID makes it better. So, it would be a good idea to maybe top up your vitamin D if you are low, so that in the case that you do get infected, maybe your severity is less. But there's no indication that taking it is going to help. It's being prescribed a lot because, well, it doesn't do any harm, so what the hell, let's give it a try. But there's no real magic bullets, unfortunately.
Okay. Yeah, that's great. And that's our approach too. So I like that. So that leads me into my next question. So, we've got coaches watching here, and we are going to be using this tool to coach our clients as well, on our one-on-one program. And then obviously we coach the community. So what role can we as coaches play in guiding people back to exercise?
So I think coaches play a vital role because, I mean, there's no way that every single person with COVID is going to be able to see a sports physician. There's just not enough of us around. And so, the coaches can play the role of, if they're knowledgeable enough and if they apply, some of these algorithms that we've been through, they can be the ones who help to triage patients and make sure that those ones that do need to be seen are seen, so they should be advising patients in terms of when it's safe and when it's not safe, and whether they think that they should be heading, to a doc. And if in doubt, absolutely refer, So yeah, I think coaches do have quite a big role to play, and a responsibility to have some knowledge on the topic, because it's going to be very common over the coming months.
Awesome. Thank you. All right. So I do see a few more questions there, but I think one of the ones that may tie in a little bit more. Sorry, Jarrad, I didn't prep you for this one, but I think you can help me quickly with this one. You say, like, if you're displaying cardiac symptoms. So as a layman, how would I know what would be considered cardiac symptoms? And, because we don't want everyone flooding to the doctors to go get those ECGs. So what would be it's hard to say, but what would you say would be some of the symptoms to look out for, and then to say, okay, you're experiencing symptoms? Is that a fair question? Because I know we monitor heart rates, and we have, yeah, like there's so many ways that we can do it at home. But I just want to make sure that we're not sending everyone to the already, crowded. Yeah, you know what I'm trying to say.
Sure, yeah, got you. So in terms of heart rate, just because you mentioned that, it's not all that useful, because I think most patients, when they get back into exercise after COVID, are going to have an elevated heart rate. So they've lost a lot of fitness, and their effort tolerance will be less. So unless you're really seeing big spikes in heart rate, so the heart rate shooting up to 180 at a relatively easy pace, or they're getting palpitations where the heart rate's saying it's 220 and it can't read it, or the heart rate's the monitor is showing an error or something like that. That obviously is a reason for concern, and those should be referred. But people who are waking up and their resting heart rate is 10 beats higher than it used to be, I think that's something that can probably be expected. Their heart rate at 150 watts on the bike is going to be, again, 10 beats higher than what it used to be. And I think that's okay. But when we're talking about cardiac symptoms, we're talking more about chest pain. So that would really be something which would be a worry. Cardiac chest pain is usually described as a heavy pain. So it's almost like there's a weight on your chest. It's poorly localized. It's usually sort of central, and it feels like something pushing on your chest. So chest pain would definitely be one to look out for. Palpitations are when you can feel your heart beating abnormally, so skip beats, or your heart really suddenly really rushing off and beating very rapidly for no reason. So those are palpitations, and that would certainly count as well. Shortness of breath would probably also count as a cardiac symptom. It can be caused by the lungs, but it can also be caused by the heart not pumping as effectively as it's supposed to. And the other one is fatigue. So everyone's going to be a little bit fatigued, but if your fatigue is really quite severe, and you can't even think about getting on your bike or going for a walk, then that's really something which would count as a cardiac type symptom. So those really would be the main ones to look out for when talking about cardiac symptoms.
Okay, thank you. That's very, very helpful. I think we've covered most of the questions. I do see that there's a few in the comments there. So maybe you and I, Jarrad, can hop on there at some point and just answer any ones that we see. But I just want to say thank you so much for your time, for your preparation, for helping us with this. Absolutely appreciate your time and what you've gifted us with today. So many answers to the questions. I think the majority of, I liked your slide of, everything is fine, but don't panic. And then it feels like the world is falling apart. I think we're in that season in our lives where it just feels like everything's falling apart. But this gives us a guiding, just a guidance that we can follow. And especially as we are guiding our clients, as we're guiding this community, it gives us the tools that we can use. I also see Coach Kelly, who is our injury specialist coach, who is on here as well. And Kelly had mentioned that she's going to be maybe connecting with you, Jarrad, to take that flow chart so we can use it for our clients. So that's very exciting as well. So awesome. All right, team, if there's any other questions, please pop them in the comments and we can get back to you on them. If we don't have the answer, disclaimer, massive disclaimer, like Jarrad said, we're just sharing ideas, and the research that's out there, it's open, but Jarrad has guided us so nicely through it and given us advice. But please go see your doctor if you're feeling like you need to take this further. Please don't try and avoid your doctor based on what we've said today. We want you to be wise, we want you to be smart, but we also want you to see the importance of taking care, and especially for our Can I Just community, who just wants to go straight back into fitness. And listen, this is why we love this community. People are so excited about their fitness and their wellness, and we want to get you back on track as soon as possible. But please be wise, please be safe, and make wise choices with your fitness journey, because it's going to be detrimental if you don't. That's the first, or it can be detrimental. I shouldn't say it's going to be. And then secondly, for the coaches who are going to be here, we love our clients. We absolutely want to do the best for you. So please listen to your coaches when they tell you to take it easy. We have your best interests at heart, and we want to guide you, and we can guide you through it. And we will definitely refer you to a professional when it's needed as well. So yeah, know that your coaches have your back. So don't fight with them when they're telling you to hold on and take it easy. All right, Jarrad, any final thoughts from you?
No, not really. I mean, thanks very much for having me on. It was fun. And then, yeah, I mean, if there are any other questions or queries, then you can get a hold of me at the practice, and we can work through it. But yeah, just try and be responsible in terms of your return to exercise. You'll get there. It's going to require, you know, a little bit of patience. But thanks again.
Thanks, Jarrad. All right, everyone, that's us for today, and we will see you. And yeah, maybe we need to do another session on COVID another time. But for now, I feel like this was very informative. So thank you, and we will see you guys next time.